Welcome to Doctors on Call. I'm Jenna Miller. A concussion is a type of traumatic brain injury that happens when your brain is jarred or shaken hard enough to bounce against your skull. This can happen when two athletes collide, or someone falls and hits their head or is hit on the head. If recognized and treated properly, most people will recover fully from a single concussion. However, if someone sustains multiple concussions, they're more likely to experience prolonged post-concussion symptoms or cognitive impairment. Concussions, that's our topic today on Doctors on Call with our guest, Dr. Stacey Jones, and physical therapist, Teresa Hyman.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Regional Hospital, experts, neighbors, friends.
Welcome back to Doctors on Call. Dr. Stacey Jones is a therapeutic optometrist born and raised in Northwest Kansas. After graduating with honors from Kansas State University in Manhattan, Dr. Jones went on to obtain her Doctor of Optometry at the University of Houston College of Optometry in Houston, Texas. She completed a rural family practice externship at York Eye Associates in Gainesville, Texas, and an ocular disease rotation at the Eye Center of Texas in Houston. While at the University of Houston, her emphasis was in ocular disease management and pediatrics. She is a registered dietitian as well as a diplomat of the American Board of Optometry. Dr. Stacey worked for Kendall Krug OD in Hays, Kansas for more than 15 years before opening EyeSmile Vision and Dental in January 2019 with her husband Jared, who is a dentist. Teresa Hyman is a 1988 graduate of KU Medical Center. Teresa worked in Kansas City performing physical therapy in areas of acute care, inpatient rehabilitation, as well as a wheelchair seating specialist for the Olathe School District. Since 1994, Teresa has performed therapy in the Hays area in the fields of home health, acute care, inpatient rehab, outpatient rehab, and working for the Hays Area Children's Center. Currently, Teresa is employed with Hays Medical Center as an outpatient rehabilitation physical therapist located at the Center for Health Improvement. Her field of interests include neurological rehabilitation, including head injury, concussion, spinal cord injury, stroke, dizziness, and pediatrics. Our phone lines are open at 800-337-4788 toll-free if you have any questions regarding concussions on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician or therapist. Thank you both so much for joining us tonight. We're going to go ahead with some questions while we wait for those calls to come in. First of all, let's talk about what is a concussion.
Sure. I can go ahead and begin. A concussion really is just a very mild traumatic brain injury, essentially, it's just kind of the microscopic injury that happens when the brain is moved within the skull. A lot of times it's a concussive response to a front of the skull or the back of the skull type injury. And a lot of times it's never found on an MRI or CT because it's a more of a biological injury that happens sometimes days and weeks later after the initial injury. Is there anything you'd like to add?
Tagging on with what you're talking about, I think a lot of people think about the brain as just like this mass, but it's actually made up of different lobes, and there's lots of arteries, veins, and nerves that surround it and run through it, and it's kind of floating there in the skull. You got to remember that the skull is enclosed. It's enclosed in the skull, so it's not like you have give. So whenever you get a hit or a blow, it's going to hit something because it's inside of the skull. And then I explained to some of the patients, think of it also as, you got like 4 little balloons inside of this mass, and you've got these strings coming out. So the strings coming out is actually your spinal cord. And so whenever your head or neck move around, that also gets stretched as well. So you have to, you can't just think of it as something that's inside the head, but it's also coming down through here. So whenever you get injured, you also need to address the neck as well. So,
And what increases a person's risk for concussion?
as far as previous injury, is definitely, so the second concussion is worse than the first. Increase in the risk, though, I mean, I know that some of my patients, as far as having their, if they've had any type of neck injury to begin with, or a lot of mine that have trouble getting over the concussion, maybe they've had some type of birth, sometimes birth-wise, if they have the fontanelles that have closed too soon, and then they've had to have some type of surgery. I've had those guys as well. Or torticollis at times, or weakness, just a weakness in C1, C2, malformations, those type of things definitely affect your risk of concussion. So.
And I think piggybacking off of that, there are certain activities too that can increase risk. So impact sports, being involved in the military, being older or younger and being at risk for falls and maybe hitting your head can put patients at risk for any type of head injury that would lead to a concussion as well. Or maybe improper gear in sports, maybe not wearing it properly, or something that maybe isn't worn that should be. Bicycle, motorcycle accidents, those motor vehicle accidents, also all of those would be activities that could lead to a concussion.
And what are the actual symptoms of concussion?
Oh gosh, there's many, and we probably look at those a little bit differently, but obviously a headache, sometimes it can be a vision issue, balance can be thrown off, nausea, vomiting, sometimes hyper acute awareness of sound or lights. Sometimes that can be subdued a little bit.
Right.
I think there's other things that
and just to sleep disturbance, some things that you don't think about, sleep disturbance, memory, brain fog. Most of the time they just know it's just not right. I just can't think, you know. But yeah, the light sensitivity seems to be a big one, as you very well know, and the noise sensitivity. Those two things are the ones that they don't seem to be, those are more indicative of a maybe prolonged recovery, I should say. The ones that are coming to me versus getting over it on their own. So that's big.
Yeah.
And how does a person end up in the care of either a physical therapist or an optometrist after suffering a concussion?
As far as physical therapist goes, what usually happens is concussion too. I mean, we might be talking sports, athletics, but it could happen anywhere. Just like Stacey said, I've had people with concussions that have hit their head on the bottom of a sink when they're trying to clean, you know, or concussion-wise, I've had just people. I've even had one faint in church, you know. So it's not just sports. A lot of car accidents, and you don't have to hit your head to have a concussion. The brain just is moving, you know, accelerating, decelerating, or twisting within the skull. That creates the concussion. But what was the question?
How do they end up in your care?
Oh yeah. So what happens is they're followed by a doctor for a couple weeks, 7 to 10 days. And then after the 7 to 10 days, if they're not fully back to being normal, acting normal, having normal sleep, thinking normal, not having the photosensitivity or the ear sensitivity anymore, then by 14 days they should be seeing a physical therapist or their, like Stacey too. Really important to know that, because that doesn't happen. So.
And I feel that a lot of times patients end up to me almost by accident in some ways. They're just searching for something. They know that something's not right, and they just aren't feeling better, they're not getting better, and they're just looking for answers for something that might make them just feel a bit better. Occasionally I can pick it up in an eye exam through questioning, or I might see something, but most often, for example, a student might be trying to just get through a school day and having difficulty getting through trying to read, or someone who's having a lot of really blurry vision, and they just think, well, maybe glasses can help. And Teresa and I were visiting about this. A lot of times they don't actually come feeling like it's a vision issue. Their complaints are oftentimes really obscure. They just don't feel right, they're not seeing right, they're having headaches or something associated with something that might use their eyes and vision. But most often they're not going to be referred by an outside physician. It's just when they're not getting better and they're looking for answers, typically.
And typically, who do they see first, the optometrist or the physical therapist?
We refer to each other.
Uh-huh.
It's usually, for me anyway, either the athletic trainer may state, this child's having a harder time getting over the concussion, so then they might mention it to the doctor, and the doctor will refer. A lot of self-referrals come in because they've had a car accident and they need to have something. But if I notice that we're coming along, but the visual part may need a little bit of help, then I'll call Stacey, and then she'll say, sure, I'll go ahead and evaluate. Same thing has happened in reverse, as far as if she feels it's a little bit more vestibular related, which is a new word for a lot of people, but just think of it as balance system. Then she'll refer to me. It's a team effort. I mean, concussion is very complex. And so it does take more than just one person to treat.
Do you have anything to add?
Yeah, no, that's
okay.
exactly
Well,
right.
wonderful, because we've got a caller on the line waiting to ask a question. This is Stephen on the line from Oxford. Hello, Stephen. You're on live. Doctor's on call. What is your question?
When I was 5 years old, I was playing catch with a newspaper with my brother, and he shoved me, and I hit my mother's rock garden. I have had tendonitis all my life. Is there anything that can be done about that?
All right. That'd probably be more me, I would think.
I think so.
Most likely, with that can be tricky, honestly, but we can evaluate to see about the pressure on the dura, and there's scarring on the dura. Most likely, the dura is like the coverings of the brain and the coverings of the spinal cord. It's all one, and so we can do a little bit of releases to see. It probably would just be maybe a couple visits at the most that I would be able to find out for sure if we can help that or not. Some of the damage and the scarring, is a little much to be able to get over that. The nice thing is that the brain, and hopefully you found some of this out, that the brain can ignore, kind of like if you're by a railroad track and you moved in by a railroad track and there's just a lot of noise there, and at first you notice it all the time, and then later on your brain starts ignoring it. And a lot of people are walking around with your condition, and their brain is able to ignore it, except for at night when you're trying to go to bed sometimes. But the brain's very adaptable. So yeah, I mean, you can come on in and we can do at least a couple sessions, we know, at that point.
Okay, we're going to go back to the phone lines. We've got Kathy on the line from Scott City. Hi, Kathy. Go ahead with your question for our guest tonight.
Yes, I have been diagnosed with cone rod dystrophy. It's been about 6 years ago, and it's just been like in the last week, it's gotten so bad that I can't read my mail, I can't do the computer. Is that normal?
Yes, I think that what you're experiencing is just that slow deterioration of your retinal cells, the cells in the retina. There absolutely could be something else going on, but but you do just probably notice that there's a progression in that disease process. And so most likely that's what you're experiencing. But it certainly wouldn't hurt to get your eyes checked just to see. When was your last eye exam?
Hasn't been, maybe a year ago.
Okay.
Maybe not that long ago.
Yeah, I think it would make sense if this seems to be something that's fairly recent, that it would make sense for you to have your eyes checked just to make sure that there's not something else in addition to the dystrophy that might be causing the issue.
Okay, great question. Let's talk about what is vision therapy.
Sure. I think vision therapy is also sort of a new term that not a lot of people are aware of, and the best way I can describe it to most patients is it's a lot like physical therapy with very specific focus on the eyes and what we do. So we look very specifically at how the eyes focus. We look at the visual field and how the patients function in space, their central vision versus their peripheral vision. Eye movement is a large part of that. And while we're doing that, we're also looking at the vestibular system as well, the balancing system, because those two systems coordinate very well together. And so a lot of 70–80% of what we take in and how our bodies respond is taken in through the vision system. And so we work very closely with exercises that will rehabilitate that system. If we're not making progress, then of course that's the point at which I would refer to Teresa to do some physical therapy. But the therapies really in some ways look similar, I think in some ways, but we're very focused on how the eyes themselves are functioning.
Now, do you find some patients benefit from one or the other, or do they work well together with physical therapy?
I feel they work well together. What I do is, I was even talking with Stacey on the way up, as far as, exactly when she would prefer us to refer back and forth. For me, I work primarily with the vestibular system, but I also work with the direct connection. There's a direct connection between the ears and the eyes. It's a reflex. So like if I turn my head 20 degrees to the left, my ears will tell my eyes 20 degrees to the left, okay, so that my eyes know where to go. If they don't know where to go, then there's this stutter in them, and they're trying to, and that creates a queasiness, and she can tell you all about that too. So we work to reinforce that. It's called the VOR. There's also a direct connection between the neck and the eyes as well, and we work with that. As far as so we do a lot of the baseline for Stacey as far as the visual goes, and then she gets into the real specifics. But the other thing is she can help us too, and she can tell you more about that. But as far as creating some prisms, a lot of times after concussion, people have a hard time crossing midline, which is right here, because you got an eye here and an eye here, an ear here and an ear here. And whenever you hit midline, they got to kind of switch who's using what. Does that make sense? So that midline is real important. Stacey comes in on that because she can create some things on their glasses to help get over that bridge. So you can fill in there if you want to.
Yeah, I think besides vision therapy, as Teresa mentioned, sometimes it really is just a piece that we can add to the glasses that can help settle the system down. I always say that the eyes are a direct connection to the brain, and they're just a part of it. They literally are connected. And so if there's one little piece that I can fix, just even temporarily, then it can make her job so much easier, and vice versa. So as she mentioned, sometimes it can be a filter on a lens, a certain color if we're real sensitive to light, and sometimes it can be prism that can just sort of shift the world in which they're living, because our eyes are made such that if they can come into tandem together and create that depth perception, then they're working together. But if there's any piece of that off, then we lose that ability to really understand where we are in space, and that can be very disconcerting to someone who's been they know what normal is, and they're trying to get back to that. And so sometimes just those little things can really help get over that hurdle that they might be facing.
Excellent information. Let's talk about what kind of equipment is available for concussion management.
Sure. Well, at the center, we have what's called the Balance Master. It's a big machine that you step into, and we have you geared up a little bit so we know you're not going to fall. And then there's a platform that you step up into. What it does is it teases out how much you're using. There's 3 things that affect your balance: the eyes, the ears, and the joints. The joints, basically, that's pretty obvious. You can feel if you're shifted more to one side or the other through the joints, if you're putting more weight on one side or the other. The eyes tell you where you are in space, because they tell you if you're getting closer to something, then that object's getting bigger. Further away, the object's getting smaller. And then they line you up with everything around you as far as balance goes. If you've ever been in a funny house where everything's crooked and that floor is flat, but you swear it's not, that's how much your eyes affect your balance. So that's something that people can relate to. And the ears affect the balance. They tell you if you're starting or stopping, or if you're turning. And the 3 of those things work together. So what this Balance Master does, concussion management, is it tells you how much percentage you're using of each. So if you're using a low percentage of one of them, then that's the one that we help out with significantly. The center also has a piece of equipment called, it's a VSR Sport. You step up on a platform. It gives you biofeedback in the sense of visual feedback as far as how much they have a little man there, and the little man's shifting with you. And then it also has a headset that you wear so that you can turn your head back and forth and train with that VOR that I told you about. So if you're turning your head to this far to the left, and then your eyes need to continue reading something in front of you, and it's called gaze stability, which is a big problem if you've had a concussion. You very well know that too. So those are some things. And then the neck has a large component for concussion management. As you know, it's not just the head that gets hit. The neck absorbs a lot of the force. And so a lot of the joints within the neck can get offset or create some strain on that dura that's running up and through. So we retrain that as well. There's a little laser light, kind of like a cat light, but we have a big chart, and so they've got this cat light on their forehead, and they're trying to make their way through the maze as it's a laser, red laser, and it works really well.
Awesome, wonderful. Okay, we've got another caller on the line. We've got Jenny on the line from Wichita. Hi, Jenny. Go ahead with your question for our guest tonight.
My son is a first grader. He's a struggling reader, and he's recently been put in glasses. And I was just curious if you do any dyslexia testing and how vision therapy might help him.
Did you get that first part? Can you repeat the first part of your question? You're real quiet.
My son is a first grader, a struggling reader.
Okay. And I think that was the second part of your question regarding dyslexia.
Any type of dyslexia testing and how they would benefit maybe from vision therapy?
Sure. I think that's a great question. I get asked that question an awful lot. If I do any testing for dyslexia specifically, no. The answer to that is no. There are other ways about going about testing for dyslexia. However, a lot of times just having an eye exam with someone who does vision therapy can kind of tease those things out and decide whether or not it really is in fact something that looks like dyslexia or something that would require and maybe be remedied by vision therapy. So in a lot of those littles who are really learning to read and struggling to read, I think the very best thing you can do is just to find an optometrist who does provide vision therapy, who can really look at at all of the things beyond reversals, which are very common in that age group. Sometimes it can be a simple tracking issue that we do see in concussion, but we oftentimes see that in children who have never had a head injury. So sometimes it's a tracking issue, sometimes it can be a focusing issue where the eyes are not focusing correctly, and sometimes it can just be an eye movement issue. So those things can be pretty easily fixed through vision therapy. So hopefully that answers your question.
We have just about 30 seconds left for the show. Let's talk real quick about what you can do to get better after a concussion.
All right. I think the main thing is initially the first 48 hours you do need to just rest the brain, period. It's trying to heal. So, no texting, no excess noise. Wear sunglasses if you need to. Just get the stimulation down and give it a break. And then after that, it is important to stay active, but just controlled activity. And then after 10 days, 14 days, if you're not back to normal, then you need to seek help. At that point, if you're a student or working, that type of stuff, make sure that the work and the school, you're graded into that. I mean, first you just tackle your daily activities of getting dressed, and then you can tackle maybe homework at home, and then you tackle homework at school with accommodations, longer test taking, or getting out of class early so you're not in a busy school where they're all changing classes. After that, then you can grade. But you got to be okay at work at school before you start doing the physical sports or any activities. Back to that.
Okay.
Get the brain going.
Excellent. Thank you both so much for being our guests tonight on Doctors on Call. Next week we'll be discussing dental health with Dr. Jared Jones. Thank you so much for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.